You've likely come across those headlines. Penises are getting smaller. Chemicals are harming men's hormones. It's all over the place. Social media, news reports, even trending TikToks. And to be honest, it can feel pretty alarming. I'm Dr. Rena, a urologist and pelvic surgeon. Today, I'm going to walk you through what you should stop doing to help prevent penile shrinkage. And no, it's not about living in fear of environmental chemicals. Also, number 4 might surprise you. It definitely caught me off guard. So stay tuned for that. Now, let's dive in. The top 6 habits you should quit to protect your penis. Number 1, stop smoking. If you care about your penis, avoid smoking. That's because smoking harms your penis in not just 1 or 2, but 3 major ways. First, it damages your blood vessels. Smoking leads to what's called endothelial injury, which means it harms the inner lining of your blood vessels. And remember, strong erections depend on good blood flow and healthy vessels. Without them, getting and maintaining an erection becomes difficult. The chemicals in cigarette smoke also interfere with your body's ability to produce nitric oxide, which plays a key role in triggering erections. Without enough of it, erections become weaker and shorter. Second, it leads to oxidative stress and tissue damage. In simple terms, smoking floods your body with harmful molecules known as reactive oxygen species. These molecules attack blood vessels and the erectile tissue in the penis, leading to cell damage. As a result, healthy smooth muscle and endothelial cells are lost and replaced with scar tissue, which doesn't stretch the way healthy tissue does. Third, it causes long-term structural changes and fibrosis. Over time, smoking increases collagen buildup in penile tissue. You can think of it as the penis becoming more rigid and less flexible. Research has found that heavy smokers have less smooth muscle and more fibrous tissue in their penis compared to non-smokers. This scarring makes it harder for the penis to fully expand during an erection, leading to reduced length and thickness. The good news is that research shows men who quit smoking often experience better erectile function and improved blood flow. The sooner you stop, the greater your chances of preventing or even reversing the damage. Number 2, try to avoid gaining excess weight. Technically, your penis doesn't actually shrink when you put on weight, but here's what really happens. As you gain weight, fat also builds up in the area above the pelvis, and this can make your penis appear smaller. That's because the penis isn't just the part you see externally, it actually extends inward and curves down toward the perineum. So in reality, you're not losing length, but you are losing what's visible. In some cases, men may appear to lose up to an inch of length simply due to weight gain. Number 3, use it or lose it. I'm not a big fan of that phrase because it can make people feel like something is wrong if they're not sexually active. But there is some truth behind it. When you have an erection, oxygen-rich blood flows into the penile tissue. This oxygen supply is essential because it keeps the tissue healthy. Smooth muscle cells and all the erectile tissues rely on regular oxygen to remain functional and flexible. Now, if you're generally healthy, your body has a natural way of protecting you. Even if you're not having sex or masturbating, you still experience 3 to 5 erections during sleep. During these nighttime erections, oxygen-rich blood is delivered to the penis, helping maintain tissue health. That's also why many men wake up with what's commonly called morning wood. However, when your health declines due to conditions like high cholesterol, diabetes, high blood pressure, or heart disease, those nighttime erections can stop. And you may also notice the absence of morning erections. That's when problems begin. Without proper oxygen supply, the tissue starts to suffer, and over time, this can lead to shrinkage. In fact, studies show that men who go 3 to 6 months without erections can lose about 1 to 2 centimeters in length. If you begin to notice a lack of erections both during the day and at night, it's important to speak with your urologist and your primary care doctor. Number 4, and this one really surprised me, don't allow your children to become obese. The reason is that there's evidence suggesting that boys who are obese may end up having shorter penile length as adults. How do we know this? A small observational study conducted in Vietnam looked at 290 adult men. Researchers measured their penile size and compared it to their estimated childhood body mass index. They determined this by analyzing 3D models created from childhood photos taken before puberty. So when researchers took those measurements and estimated prepubertal BMI, they found that childhood obesity was associated with shorter penile length in adulthood. However, obesity later in life didn't actually change true size. It mainly affected how things looked, because as we discussed earlier, extra fat in that area can hide part of the penis and make it seem smaller. The reason experts believe this happens is that before puberty, the body goes through a critical stage of genital development. If a child is obese during this time, it can interfere with important hormonal and growth processes that are necessary for normal penile development. So what's the takeaway here? If your child is struggling with obesity, seeking guidance from your primary care doctor, a nutritionist, or other available resources may help prevent long-term effects on their development. Number 5. Avoid diabetes, and if you already have it, keep your blood sugar under control. This is something I personally pay attention to, since I have a strong family history of diabetes, and South Asians are at higher risk. It affects both men and women, but let's stay focused here. When diabetes is poorly managed, consistently high blood sugar can damage tissues over time. It leads to cell death through several different mechanisms. One major issue is inflammation in the penile tissue. Healthy, smooth muscle cells begin to die off and are replaced with dense, fibrous scar tissue. That should sound familiar. We discussed a similar process with smoking. This also reduces elasticity and can impact the overall size of the penis. In addition, diabetes harms blood vessels by lowering nitric oxide production, which, as we mentioned earlier, is essential for triggering erections. It can also cause nerve damage, particularly to the nerves that control blood flow and sensation in the penis. Over time, this can lead to tissue atrophy, meaning the tissue gradually wastes away. If your diabetes is well managed, this isn't as big of a concern. But if it remains uncontrolled for a long time, the loss of smooth muscle and increase in fibrosis become more significant. On the other hand, keeping your blood sugar in a healthy range helps protect your penis. So if you're living with diabetes, monitor your hemoglobin A1C regularly, maintain good control, and if you're experiencing erectile dysfunction, don't ignore it. Speak with your doctor and work on restoring normal function. Next, don't ignore changes in your penis. One condition to be aware of is Peyronies disease. It's commonly linked with a noticeable curvature of the penis and involves the formation of plaque within the tissue. When this curvature develops, it can also lead to a shortening of penile length. Now, there isn't a guaranteed way to prevent this condition, but we do know there are certain risk factors. One of the main ones is penile injury or trauma. Experts believe that Peyronies disease often develops from repeated micro-injuries, which can happen during more vigorous sexual activity. Now, before you think this means giving up an enjoyable sex life, that's not the message at all. Variety and excitement do matter. But there are a few practical steps you can take to lower the risk of injury. First, always use enough lubrication during sex. Second, try to avoid overly aggressive or high-risk positions that could put your penis in a situation where it might bend or buckle. And if you're feeling adventurous, make sure you're in control of the movement, so you don't get hurt if your partner accidentally moves in a way that causes impact or strain. Another helpful step in reducing the risk of this condition is managing your overall health. More and more research shows that issues like diabetes, obesity, and heart disease are linked to a higher chance of developing Peyronies disease. The thinking is that these conditions affect blood flow, increase inflammation, and interfere with proper healing in the body. All of these factors may play a role in the development of abnormal scar tissue in the penis. And finally, if you begin to notice pain during erections, a new curve, or any unusual bending, don't ignore it. Schedule a visit with a urologist. First, it's important to rule out anything serious. Second, early action, whether through lifestyle changes or treatment, may help preserve length and prevent the condition from worsening. All right, that brings us to the end. These are the top 6 habits you should avoid if you want to protect against penile shrinkage. If you found this video helpful, share it with someone who might benefit from it. The truth is, many men don't talk openly about sexual health, and that needs to change. Sharing information like this can help others who may be struggling quietly. Let's help make these conversations more normal. And as always, take good care of yourself because you truly matter.